Hello, everyone. Welcome to Journey Home Mentorship Program. This is officially our first live series and live session, and I'm so excited to connect with everyone on here. We're gonna have an exciting time. I just want you guys to just comment in the chat wherever you're logging in from, whether it's YouTube, Facebook, or LinkedIn. Just log in and let me know if you can hear me. Just send the comments and let me know if you can hear me so far. All right. So I'm so excited um, to come on here and to be here with you guys. Um, First of all, thank you so much for taking the time out to hear about Journey Home Mentorship Program and what it's all about, and start this journey on learning more about how we can optimize um, your journey in medicine. So essentially, over the years, I have been able to. Well, first of all, I'm Dr. Gentles. Just introduce myself. I'm a family medicine physician here in Toronto, Ontario, Canada. I've been practicing for about 8 years now, and I've had a wide range of experience locally here in Canada and also abroad in several different countries. And over the years, I have essentially helped many individuals on a one on one basis. And so the birth of Journey Home Mentorship Program came from the realization that there is a need for mentorship in the medical community at different stages of one's journey along the way. And so, in essence, today marks a very important day. I have considered it the launch of Journey Home Mentorship and official first training series that we're about to do. So get excited, and I hope you do enjoy today's session. Tomorrow will be even more exciting day. We have a guest speaker by the name of Dr. DeClaire, and she has a very rich history and story to convey and tell. And I know that you all will be able to learn from her experience and from her story over the years. All right, so let's get started. All right, so as I said, welcome to Journey Home Mentorship. So we're all on some form of journey. Um, in regards to what essentially the name Journey Home. Most people probably are wondering, how did I come up with the name Journey Home? So we're all on some form of journey, and I consider it a journey home to a place. And so we're all trying to find a place that we consider a place of safety, and even as a place where we find a sense of peace. Some people call it peace of mind. And within the scope of medicine, it's the same thing, whether or not you're trying to figure out if the career is for you. You're trying to figure out if medicine is really home for you, or if you're in your training, you're also trying to figure out, okay, what niche of medicine do I fit in? If you're done your training and you're practicing, you're finished. You finished your training and now you are about to start a practice or join a practice. Now the decision is, where do I fit in, and where do I want to set my roots, and where do I want to establish myself? Essentially, where do I feel comfortable? Where do I feel, in essence, where do I feel at home? All right, so today's session in particular will, especially speak to pre-med students, those students who are in high school, college, or university, and even individuals who are more mature and are looking into perhaps changing their career or considering medicine. Now, for the individuals um, who are already in training and in practice don't lose interest quite yet. This is an opportunity to essentially reevaluate yourself and ensure that you're on the right path and you basically have made the right decision for yourself. Because sometimes it's really until someone is really deep in their career, they realize, oh man, this is actually not for me. And while it's good to come to that realization, if that discovery comes up pretty late in your career, it's just a kind of a more taxing issue. It can be resolved, but it just takes a little bit more time, sometimes energy, and even money. Lost income sometimes to make that transition. So the earlier you know where you stand, the better. All right. So the fundamental question here to ask yourself is why medicine? Now, I firmly believe that there are three major ingredients to someone's success in medicine. The first ingredient I believe one should have to be a a successful student of medicine and successful professional in medicine is passion. The second ingredient includes purpose, and the third includes skill. Now, just to give you a background, I there is a there's a really there's a person I admire a lot. It's actually a French teacher of mine. He's really good at what he does. He The way he teaches French to his student and to me at one point, he makes it extremely enjoyable and extremely simple. And the way he taught the topic, you can tell that he loves it. And you can tell that it's not just a job. Like his job as a French teacher is not just another a job that you just go to work and get an income. He never seems to be frustrated with his work. He never spoke ill about his work and complained about the job and challenges. He's always just seems so content. So I asked him a few years back, what makes a person successful in their career? And in general, he actually told me these three principles, and I've come to adapt them, and I believe they're really true. Now, the first is passion. So passion is essentially so in medicine you have to be passionate. You have to be passionate about the patients that you want to take care of or you are taking care of. You also must be passionate about the topic really of medicine and the study of medicine. Without this ingredient, without the love of people, without loving the actual topic that you will be delving into day and night as a student and essentially thinking about for the rest of your life. Um, Very quickly, medicine in of itself will get very stale, very old. You won't really enjoy it. And in fact, this ingredient keeps you safe. It allows you to make decisions that are good for you and also safe for your future patients. So without passion, it's not quite possible to really uh, it's not sustainable essentially in medicine. You need something that keeps you going. You need something that keep you in the work and in the job that you're doing, because there are a lot of challenges and you want to have that factor that keep you basically ethical and right in your motives of practicing medicine. The second factor and ingredient that you must have is purpose. And so, purpose is something that is sometimes overlooked. because not many people think of themselves as having a purpose in medicine. Some people, yes, they love to take care of people, and they love the sciences, of course, biology, chemistry, physics, they love all of that, but they don't really get a sense of purpose. And purpose is really, what is my role here in society, and what is the greater good that I can contribute to. And in another seminar, we will go into how do you find your purpose in medicine, but it's in essence, you need to ask yourself, what keeps you up at night? What do you keep thinking about? And also, the very thing that essentially bothers you in a sense. Sometimes it's a societal issue. For example, for myself, I can't stand seeing poverty. When I see people begging on the street or homeless people on the street, it bothers me a lot. So I know that one of my purpose is to contribute to some change in that area. And so this is a very important ingredient for your success in medicine, because this is what separates you from just being a regular physician, and from being an exceptional physician. The doctors in society that make the greatest impact are those who run with their purpose despite the challenges that they face, because there's challenges in every domain, but if you have purpose, it will keep you grounded, and it will keep you going on, essentially, from chapter to chapter and throughout your journey. And it will also make your work quite enjoyable and quite pleasurable. The third ingredient here, and actually very important one, is skill. Before I move on to skill, on the topic of purpose, it is okay to enter medicine without knowing your purpose. This is actually something that evolves over time. It's actually quite, it can be, some people know their purpose early on in life, but it may take a few years to actually understand that. So don't be discouraged if you don't quite know your purpose yet in medicine. It is not a disqualifying thing if you don't have a purpose. In fact, purpose and passion, they're very much intertwined. And so you can still do well with just having a passion and still trying to discover your purpose. Now, the last ingredient is skill. This is very important. So, unlike passion and purpose, with passion and purpose, these are things that you can't necessarily learn in the classroom. No one can really tell you how to do these things. You learn and you develop it over time. And but this is something that is driven by the individual. Now, skills, some people are born with certain skills which are great, but the difference with skill here is that with skill, it can be taught, it can be developed over time. And this is where your medical training comes in. This is where your preparation comes in, through high school to university to a medical school to residency, and for some individuals, fellowship. And if and you know medicine is a lifelong journey where you keep learning, so definitely skill is very important. And so if you think about it, let's start with skill. If you have passion, you love people, you want to see them in their best, with their best health. You love science, you love solving problems, and you know that you have a purpose to contribute to women's health, for example, but you lack the skill. You have troubles with problem solving. You don't have the skill of social interaction and interpersonal skills. Those are very lacking. Or critical thinking is an issue for you, and in fact you struggled with all the sciences. I mean, that's a big problem. Do you get the picture? And so having skills, very, very important. Now imagine that you are very skillful. I mean, you are top on your class, sciences. You aced it. Um, in terms of your interpersonal skills, you present yourself well, you communicate well, you problem solve well. You have no issues there. In fact, skills like emotional intelligence, you are very masterful at that, and so that's not even a problem for you. But you really don't care too much about patient outcomes. You really just want to do the job and move on, but not quite to the point where you care so much. You can, that is a problem, right? Or let's say the other aspect of things, you love to work with your hands, but you really don't like the sciences. You don't like the sciences, but you know that you like building things, you like to work on things, but the sciences are not your desire, not your top subject matter. That would be a problem in medicine. If that sounds like you, that means you probably need to reconsider the field. Now, why not medicine? So it's very obvious, for some people it's obvious why medicine will not be the field for them. But for others, it may not be that obvious. But I've just mentioned 3 points here. They're not exhaustive, but the first point I just want to bring up here, that many years ago, medicine was one of those fields where prestige was associated with it. Um, I am sure over time and over decades and generation after generation, this is like slowly, slowly fading away, and people are understanding the actual reality of medicine. Medicine it's a great field. It's an honorable field. I mean, it's a job where you essentially can save people's life. Like there's nothing more satisfactory than that, to be able to help people to the extent where you help to recover their health so that they can enjoy their life and be with their family. That is one of the greatest privilege you can have as a doctor. But to go into the medicine for the title of being a physician, for the perceived prestige of it, it's definitely not a great idea, because soon you'll realize that medicine is hard work. Medicine comes with a lot of sacrifices, and medicine comes with challenges just like any other field. So it's not really a factor that will keep you in the field. In fact, if you go into medicine for the prestige, very soon you'll realize that it's not worth it. Not to say medicine isn't great. Medicine is actually wonderful. I enjoy and I love the fact that I'm able to help people, but definitely would not advise anyone to go into the field because of any type of prestige that you think the field may have. Now, the other part that people consider here is the financial security that comes with being a doctor. Now, there is a level of financial security that you have as a physician, but the question is, what's the cost of that financial security? What are you giving up for that financial security? And this is a topic that I will expand on in the future, or if there's any questions today, I can answer it. But let's just say there are better ways to make money than going to medicine just for the sake of money, because the cost of being a physician is great. Very often, as physician, we work a lot of hours, and these hours are uncounted for. And we do it because we love what we do. We do it because we're passionate, and we do it because we have a purpose. And the financial stuff, it just comes with it. It comes as a result of the hard work. But to do it solely because of the financial benefits, soon one will realize that it's not quite worth it if it is the only driving force keeping that person in the field. And then lastly, going into medicine in order to, meet the expectation of others is also not a great idea. It's not a great idea in general, for any field at all, but especially for medicine. It's a long training, but very rewarding actually, and the financial investment is pretty large. And so you do not want to make a decision, whether it's for medicine or any career, because you're trying to either please someone or meet someone's expectation. And I brought this up because not many people, not everyone struggles with this, but there are certain cultures where it is expected that you be X, Y, and Z. You're either a doctor, you're either an engineer, or you're either a lawyer. And so I understand that pressure. I understand that kind of pressure that you may get from either family or friends. In fact, I came across a young lady in the hospital who was experiencing a similar set of pressures. And after talking to her, really, I realized her interest was really in business. And, I'm happy to really report that she, um, she didn't feel as pressured to go into medicine. And what she pursued really is what the healthcare sector needed. The healthcare sector really needed, really, to be built up as an infrastructure and supported by people that are business minded like her. So her goal now is to be almost like a CEO of a hospital or of a healthcare organization, which she is so much more excited about than the actual bedside care of patients. And so, as you can see, even though you have these pressures of, or even though you may face these pressures of going into medicine, there's actually ways around it. You can still be in the medical field, in the healthcare field, but come at it from a different angle, and that may be actually more satisfactory. So, what is medicine all about? So, I mentioned before that medicine is a lifelong journey. Throughout medicine, you never stop learning. There are always new technology, new research, and we're always trying to improve ourselves. We're always trying to be better at what we do, and you have to be ready to want to learn something new all the time. And for many of us in medicine, it's very exciting. We like to be, on the top edge of research. We like to offer patients the best that's available to them. And it's very exciting, especially when you are communicating with other people from different backgrounds, people from the UK, people from Australia, and comparing what they're doing in their countries and being able to apply to your patient population. So being excited about lifelong learning is something that one should look forward to in medicine. Now, in medicine, you really have to be diligent and resilient. This is very key. This is key to being successful, a successful physician, and also a successful lifelong student. Medicine is about diagnosing and managing patients. So it's all about problem solving and helping a medical team to come to a diagnosis so that this patient can get well and can be at a better state in their health. And also, for myself being a family physician and from a preventative care standpoint, helping individuals to stay healthy and help them to prevent illnesses. Now, medicine is all about the humanity of patients. We cannot practice medicine or or be really good at what we do without really caring, catering for the patients and ensuring that what we do is all about what the patient desires. Let's face it, that's what our goal is. Our goal is to help patients. Our goal is to help them be well. It's not really a it's not so much what the doctor wants the patient to have, but um, the culture of medicine is shifting, and it's all about patient centered care. And that's something you will learn about in your training. Now, I want to bring up this part here that many people fail to think about, fail to include. But medicine is also about the humanity of physicians. And so this here, especially, is not very well highlighted in our training, but um, it's getting its traction, um, kind of more and more traction over the years. But the wellness of physicians is also included in the practice of medicine. And so, in pursuing medicine, in studying medicine, you must, care for yourself. You must look at your own well-being and understand even your own limitations, so that you can be the best physician that you can be, and you can have reasonable expectations of yourself. The mere fact that we're not machines, just tells you that we can make mistakes, and being okay with that. So um, understanding that medicine is not about being resilient to the point where you cannot make mistakes, because that whole thought process will lead to burnout. But being resilient, but yet graceful and flexible with yourself to understand that you will make mistakes, and if so, it's only an opportunity to grow and to learn. Okay, so my experiences so far. So I decided to become a physician. Really, basically when I was in high school. That's when I started seriously thinking about becoming a physician. But I didn't quite commit to the career itself until I was in university. And so I just to give you a background here, I went to high school in Jamaica, and I migrated to Canada when I was about 14 years of age, and I continued to grade 11 and grade 12. I was already in the sciences at that time, and I graduated and went to Master University in Hamilton, Ontario, Canada, and when I uh, the accept the accepted the invitation to go into the sciences at Master University, one of the things I noticed was that everyone in my program wanted to go into medicine. And I thought to myself, this is not possible. And that was the very first time I did a self reflection as to whether or not I truly wanted to go into this field. And so I thought about all sorts of options in the field. I thought about pharmacy, I thought about research. At one point, I even, before accepting this program, thought about nursing. Um, and I thought about all different possibilities. And eventually, I realized I was not interested in either of the other options. And so that was the very first time I committed to pursuing medicine wholeheartedly. Um, Subsequently, I did my MCATs. Then I applied to medical school in Canada, in the US as well. Unfortunately, I did not get into medical school in Canada. I was interviewed once in the US, but did not get accepted there as well. And so this led me to consider the Caribbean. I eventually got accepted into St. George's University in Grenada, and Ross University School of Medicine, and also American University of the Caribbean. I decided to pursue Ross University, and then within 3 calendar years, I achieved my MD degree. And that led me to pursuing residency as in family medicine in Michigan, and I went to Grand Rapids medical education program in Michigan. Now, throughout this journey, um, I have to say I didn't quite have formal mentorship, or someone to really bounce ideas off of or ask questions. And I can say that, it would have been of great benefit if I had someone along the way, especially when it came to choosing my specialty, when it came to choosing my clinical rotations, and even when it came to as a graduate, choosing where to practice, things like how to negotiate my contract and so forth. And even as a physician, knowing my strength and just my status in society, what I can do and cannot do, just having that support and guidance would have been quite beneficial for me. And so really what I've learned over the years, I want to bring that back to you and really help you, anyone along their journey, to be essentially even more successful than I have been over the years. And so, most definitely, this is where Journey Home Mentorship Program can be of benefit to anyone, especially my fellow colleagues who are either practicing or thinking of even transitioning to Canada or the US. So, in fact, I would be considered an international medical graduate. I was trained in the Caribbean and in the US, and I was able to come back to Canada and practice, and I'm currently working in Canada at the moment. All right. So this is the almost we're almost at the end of our session here. I do want to open up the comments to anyone who has questions. All right. So thank you guys for coming on. I'm gonna just look to see if there's any questions here. Hi, Gabriel. I see that you're there. Welcome. All right. Okay. So I have a question here. Okay, so a question from Gabriel. So it says, what are some ways doctors can continue improving skills while in practice? Okay, very good question. So, um, essentially, as a physician, really, it's actually an expectation that doctors continuously improve their education and skills. So, we essentially keep going to conferences to learn more about the latest updates on practice guide and guidelines in certain area of practices. For the more surgical type of specialty, there are workshops that are available to help to improve one's skill set, essentially, that is needed for that field. There are things like robotics that is becoming more and more popular in this region, in Canada. And so even in the hospital, I hear specialists talking about getting their robotics training. And so this is how we keep up to date. We go to conferences, we go to workshops. We also do our own personal, studies on our own, and also the fourth option here is we're always learning from our patients. Our patients are always teaching us. Our training does its best to teach us what we need, but a lot of the learning comes from practicing, actually doing the work. And even today, a patient came to me and taught me about a diagnosis that I've never heard about. and I've yet to even do my own research on it, but we're always learning from our patients. All right. So let's see another question. Let me see here. Okay, so this person from patients is asking or is saying people typically assume that saving lives is the purpose of being a doctor. Is that true? Does becoming a doctor automatically give you that purpose? Okay, that's a really good question. I guess in essence, be yes, because I mean we all share a common purpose, which is to help, yes, save lives and to help people improve their health. Like this is a common purpose, but the purpose that I'm actually um, kind of hinting to and kind of helping you to open your eyes to is a purpose where you dig a little bit deeper. So, for example, if the thing in society, like this part of society, bothers you, for example, the best way I can describe it is something that really bothers you or speaks to your deeper being. Let's say you learned about the statistics of maternal morbidity in pregnancy, and you just see that it's wrong. You just see that it is wrong for women to lose their life this often in childbirth, right? And you want to make a difference, like so that actually will shape, you know, the choices you make, and perhaps this will lead to you pursuing, women's health, or even pursuing things like obstetrics. And in doing your work, you're not just thinking, oh, I helped this person to um, to have a baby, but you're thinking that I am helping to safeguard the life of this woman because I want to reduce the statistics. So it's like a bigger purpose. It could also manifest in itself where you do more teaching and training of younger doctors so that they can go out and change the statistics here. Or it can translate to you doing research to change that area that really you see needs improvement. So its purpose for me is bigger than just saving lives, and bigger than just helping someone become healthy. It's making a bigger difference in society, and it takes time to get to that point. All right, the next question here is by Celeste. Um, let's see. Okay, so the question is, um, you said that medicine is a journey. What would be your advice for those who are on the journey and who are close but feel like giving up? Yeah, so as I said, medicine in of itself, it's a long journey. It's many years of hard work and sacrifice. And this is where one really has to do some reflection. Those three ingredients that I mentioned before: passion, purpose, and skill. Purpose, as I said, you can really discover that at any point of your journey. It doesn't disqualify you from being in the field. But reevaluate your passion, and based on your answer to yourself, you recognize, essentially my advice to this person is to hold on to that. Hold on to the initial reason of why you went into medicine. It could be an experience that you had that gave you that aha moment that this is the field that you want to be in. Also, look into the areas that may be causing you challenges, and ask yourself, do I truly have the skills in these areas? For example, if you are, let's say, struggling with your exams, your board exams, or your prerequisite courses that are required for medicine, then ask yourself, and do I really have the skills in these areas to pursue medicine? Or is it that I have the skill, but there's something else underlying that's preventing me from being successful? For example, some people are just not good test takers, but it doesn't mean they don't have the skill and the knowledge to do well. So that also doesn't disqualify them from medicine. And so I would really recommend for this person to get mentorship, get someone in your corner to help guide you through this and work through this, so that you can figure out what is it that's really causing you to feel discouraged. And there's nothing that beats a community of people that are supportive and that will help you move on to be the best that you can be. So you need to be plugged into a community, and you need mentorship. And so if you don't have that, then go to journeyhomementorship.com. We're here to help you and here to help you be successful in whatever direction you take. All right, so there's another question here from France. Um, so it says, so he's asking, what are the requirements needed to be part of the Journey Home program? All right. Um, so there are different ways you can join Journey Home Mentorship program. We'll talk about that a lot on day 2, which is tomorrow. And so I'll just give you a brief summary here. First of all, you can see a lot of the requirements on the website. So if you go to journeyhomementorship.com, you'll see a summary of the requirements here. But if you want to join the community, essentially it's a subscription that you signed up for, and you join basically a group of like-minded individuals. And this is essentially all you have to do. And in that forum and in that community, you essentially get private access to training sessions from myself. You'll be able to interview different physicians, and we tailor the experience to individuals' needs. So and the group's needs. So as the need presents itself, we'll be able to address those needs and concerns, or any questions that the group may have. The other way you can join the program, if you are a pre-med student with intention to pursue medicine, there are clinical experience programs that are available, and that's listed on the website. There's one-on-one consultation as well that you can participate in. All right. So let's move on to the next question. This is from P. Sidhu. Um, okay, what program were you in at McMaster specifically, and how was your undergrad overall? All right. So at McMaster, I went into the general science program. It was a 4-year program. After the first year, we could choose which subspecialty per se, and so I chose to focus on biochemistry. So I did biochemistry. I majored in biochemistry, and yeah, and overall, I mean, my undergrad was great. I really enjoyed biochemistry. Now, just to kind of give you an idea of my observation in university, many people who were in the science program, a lot of them, I mean, that made me question myself. A lot of them wanted to go into medicine, and I thought this was just not possible. Someone here is not going into medicine. And so I realized that people had different approach to this. Some people, they weren't the sciences, but they chose probably what they perceived as the easiest major to do in order to go into medical school, in order to get the best grades. And so they would do that, but I did observe that people still struggled somewhat. And then there are another set of individuals who I observed, they went for the most difficult major, and that either worked or it didn't work. And some people, maybe they were successful in going to medicine, some didn't. But then there are another set of people that they did a major that they really loved, and thankfully I chose one that I really loved and I had fun. In fact, the same group of colleagues that I had in my undergrad, I still meet with them now because we love being around each other. It was so much fun. And that's my advice really to other people. In medicine, it doesn't matter really your degree. It doesn't really matter your major actually, as long as you fulfill the criteria for the prerequisites. Just do what you love to do, and everything will fall into place. All right. So the second question is, if you practice, this is also from P. Sidhu, if you practice family medicine for a few years, can you go back and update your specialty, i.e., become a pediatrician or OBGYN? Okay. So, it's a good question, but really, you know, it's once you choose your specialty, you can change. Um, you can essentially change. So I can imagine as a family physician, if you would like to become a pediatrician, like you could still be a pediatrician, but you may have to go back into residency. And they may accept some of the training that you've already done. So you don't actually have to start all over again. Um, the other option is, if you choose to just, if your desire is just really to take care of kids, you really can do that as an outpatient. Um, as an outpatient, as a family doctor, we're trained to do everything, take care of babies, to patients that are much older. So you could still do the same work as an outpatient and only take care of children. Um, Now, as a family medicine physician, you can do low risk OBGYN, OBGYN or OB, obstetrics, I should say. Gynecology is always a part of the practice of family medicine, so you really don't have to like switch your whole specialty in order to be an OBGYN. But if you want to, which means you want the surgical skills to be an OBGYN, you will have to go into residency. But if you have more questions, just send us an inquiry or book a one-on-one consultation, and that's something I can really help you with, Sidhu. All right, another question here. What advice, this is from Jayla, what advice would you give on navigating challenges such as not securing a match into your desired residency program while maintaining professional growth and resilience? All right. Okay, so this is a very common challenge. So essentially you're asking what do you do if you don't match into your residency program? So I've had a lot of colleagues who have been in this situation where they have applied to a residency program and they haven't matched. So, the best thing I can say is, whatever you can do possibly to keep up those clinical skills that you've learned as a medical student, do that. So, for example, some individual they go back to their school, for example, and volunteer to teach or mentor some of the students. If you could work in a clinical setting, or volunteer in a clinical setting, that would be very helpful. If you could do some volunteer mission or participate in a mission overseas, that also really looks good on your resume. And also keeping up to date with the medical knowledge, and going to conferences, that also would help. But most of all, you need to keep motivated, you need to keep encouraged, and so you need to be a part of a community that helps you to essentially stay motivated and not give up. And that's so important. I've had a colleague and a very close friend of mine who, it took her a long time to get into residency, but she really needed that community to support and encourage her. And because of that community, her friends, her family, she was able to stick to the course, and thankfully she was able to be accepted into a program, and now she's doing well. And this is something that everyone wants for themselves. The worst that can happen here is giving up, and you do not want to give up. You want to stick it out, and stay motivated, and stay encouraged. All right. The next question here is from Kendi. um, okay, I think he's trying to say, how do you dedicate yourself to be a physician? Why weren't you? Okay, I get it. So essentially, I think what Kendi's trying to ask here is, how do I keep myself committed and dedicated while I'm trying to be a physician? And how do I handle challenges and struggles? And how do I kind of keep moving on in these situations? And it's exactly what I recommended for Jayla. For myself, I really got plugged in with my own circle of people who are motivated. And in my journey and studying medicine, I always kind of stuck close to people that are headed in the same direction I'm headed in, and kind of thought like me. um, when you're pursuing something like this, you almost have to tune out the rest of the world, in essence. You'll get back to them, but for the short period of time, you almost have to tune everybody out, because your focus has to be a laser focus. You really have to keep your eyes on the target, and essentially not take your eyes off of it until you get to the finishing line. And you want to run with people who are doing just that. People who work really hard, but then they're they're able to balance a little bit and relax. But for a season of hard work, they really work hard. And having individuals like that around you can help you um, move on, and stick to the course. So if, for example, let's say, when I was in medical school, there's a lot of things that weren't perfect, and people would complain about things that are, in the grand scheme of things, didn't matter. It's not a deal breaker. And so there's a lot of time spent complaining. But if that time is spent resting, studying, and just, making plans for the future, meeting your goals, these things keep you motivated. I did that for the first semester of my medical school. My head was just completely down. I tuned out all the noises. And next thing I know, I was invited to this private ceremony on my medical school campus. And when I realized what was happening, they were congratulating all the students that basically were the top of that class. When I looked around, it was very few of us. And I was, not that I was doing bad, but I was surprised to be counted to be among such people. I thought I was doing average, to be honest. But it turns out that I was doing pretty well, and I can only attribute that um, to really being laser focused. And as I said, I had a community of people around me who were supported me. All right, I think that's all the time we have for questions. I'm gonna leave you with one last food for thought here. And so tomorrow we're gonna be interviewing. I'll be interviewing uh, a person who I consider a very exceptional physician. She's a very close friend of mine. But beyond our friendship, she's just quite amazing. And so I can't wait for you to come back same time tomorrow at 6 p.m. To join me in interviewing her and seeing how she um, kind of progressed through her journey in medicine and how she became so successful. But I want to introduce you to two individuals here. So here we have Beverly. Beverly is a student. Um, who wanted to who knew she wanted to pursue some career in the healthcare field. She loves to help people. She loves the sciences. She's excited about it. She got into university, but she decided to pursue nursing. And the reason why she pursued nursing is because a lot of people in her family were nurses. Her mom is a nurse. She has several aunts that are nurses. She's just surrounded by other people that are just in the nursing field. She has one cousin that's a pharmacist, but um, she knows that medicine is a possibility. But really, she was really more focused on pursuing nursing. Very excited to do nursing. She became a successful student in the nursing program. And then she later graduated as a registered nurse, and she did very well initially in her career, but something felt like it was missing. Something was missing. She realized that she was feeling quite burnt out. She tried to change. She tried to change. Um, different working as a nurse in different departments in the hospital, but this didn't work. She tried to take more vacation, but she still felt like something was missing. She yearned to be more involved in the decision making process of taking care of patients. She didn't like just doing what she was told. I mean, she's okay with cooperating with whatever is needed to help the patient, but she felt stuck. And as you can see in the picture to the right, she just felt very empty and frustrated. And she didn't quite know why. Now, tomorrow we'll continue the story and I'll tell you the outcome for Beverly. Here's another individual. This is Fred. So, Fred, on the other hand, he is the life of the party. He is very involved in athletics. He loves life. He loves his family. He has lots of friends. He's in university pursuing kinesiology because he just loves sports. And he thinks, he'll probably do well maybe as a physiotherapist. He's not quite sure. Now, towards the end of his university career, he realized that he's actually not quite ready to work, and he's actually not quite sure what he wants to do. So he decides to take a gap year. He decides to go out and pursue some volunteering overseas. So he started to volunteer, and during this volunteer experience in an underserved country, he realized that, man, I really love taking care of people. I think I want to do more of taking care of people and trying to help them to get better. He went on a medical mission trip, and he saw how people were suffering from um, curable diseases, and he wanted to make a difference there. So he came back home, and told his dad. His dad actually was a physician. He was a family medicine physician, and he grew up watching his dad in years in, years out, going to work, coming back home. In fact, he remembers going to the hospital with his dad when his dad was called for a delivery. And in those days, he was able to see the babies through the window and seeing, the babies that were born that day. And so, putting the pieces together, he decided to go into medicine. And as you can see on the right, he is very happy. He's enjoying his medical field. He never thought that he would be in medicine, but he's really enjoying the training. And today he is a successful cardiologist. Now, tomorrow we're gonna dive deep more into Fred's story. I do want to encourage you to come back tomorrow, and we're excited to have you, and kind of dig a little bit deeper with you. Tomorrow's topic, we'll be talking about mentorship and why that is the key to success. We'll also be talking more about journey home mentorship and how we can help you succeed in your journey in medicine. And we'll open the floor to questions if we have time, about the program, and also questions to Dr. DeClaire if we have time. Thank you once again for tuning in. I appreciate your attention and I appreciate your time. Thank you, and take care of yourself. Good night.